My name is David Brockind. I am a photojournalist and a film producer. I was always really interested in development issues, and about 3 years after starting work as a photojournalist, I was working on a story about tuberculosis. And I didn't really know much about TB. I didn't realize that it was such a big issue and that it was killing so many people. And the more I got involved with it, the more that I saw that it wasn't just a health issue, but it was an issue relating to poverty and all of the other social issues and development issues that I was interested in. So I kept working on public health issues, on TB and HIV and some other public health issues, really as a way to explore development in a really broad way. And it was focused on public health, but it looked at how these health issues affected people's lives broadly. One of the things that can be really hard about talking about global public health issues is that these are things that are happening to people that live in other countries and that we don't often see or understand. And you have to find a way to tell that story in a personal way that humanizes the subjects. Those are the stories that your audience is going to connect to. Those are the stories that are going to make people feel and understand the issue. But that has to be backed up with data and science and facts about what's actually happening. So my process is to start with the facts. You talk to people at organizations that are respected, you get data that can be referenced, and you really understand factually what's happening. And once you have that framework, then you start to look for the stories that can back that up. And that way the stories aren't just anecdotes that aren't really based in anything, but they're anecdotes that you can then point to data and statistics and sort of a more systematic process that can back up those stories. When I was reporting on TB budget gaps in Vietnam, one of the things that we found is that the budget gaps led to a lack of health infrastructure. There weren't enough clinics, there weren't enough doctors, and there weren't enough ways for people to get to the clinics that did exist. And that's something that's a serious issue, but it's really hard to talk about that in an impactful way to an audience. When we were reporting at one of the lung hospitals in Ho Chi Minh City, we met a grandmother who had been trying to find treatment for her granddaughter. It took her a month and visits to 4 different doctors to find treatment because there weren't doctors that were trained and there weren't clinics that were close to her house. So she would go to one clinic and the doctor wouldn't correctly diagnose TB. The child was still sick. She would go to another clinic and the same thing would happen. And over the course of a month, the child got sicker and sicker and sicker until we finally met her at this lung hospital in the intensive care unit. So that's sort of an example of how we found, based on the data, that there just weren't enough clinics and doctors in the country to successfully diagnose all of the TB cases in the country. And this was a woman who was desperately fighting to get her granddaughter a correct diagnosis. For me, the process of visual journalism is mostly based in gaining access. Actually using a camera or taking a picture is like 5% of the job, and getting to the place where you can do that is 95% of the job. And when you're trying to access a hospital setting, there's a lot of layers of bureaucracy you have to go through. You have to start by getting in touch with someone who can introduce you to the director of the hospital and get approval from him and kind of work your way down the chain until you're in the intensive care unit. And then you have to get approval from the doctor that's in the intensive care unit. And then you're there, but you still don't have approval from the patient. So you have to spend time and you have to meet patients and you have to explain to them what you're doing and hope that they accept. For me, it's really important that everybody that I work with participate voluntarily, that they really understand what I'm doing and that they want to be involved in the story. In Vietnam, when I met this woman who was trying to get her granddaughter TB treatment, I went back 2 or 3 times and I started taking pictures of her. And then we progressed to doing video, and that sort of built the story that we were doing. But it's a slow process, and it's one that requires a lot of different layers of approval and acceptance from people who can give you access to the physical places you need to be, like a hospital, to people who will actually agree to be on camera. When I'm reporting on public health issues, I'm going about things in a very similar way to what researchers or scientists are doing, but there's some important differences to the way we approach subjects and the way that we complete our work. One of the ways that is different is that they require very formal signed permissions that journalists don't always require. Another thing that I found is different is that journalists take a lot more time to get to know the people they're talking to. It's not a matter of just quickly talking to them to understand the data that's associated with their life, but it's a matter of actually spending time with them to really understand their life. And that's because we're really trying to get stories that can back up the data that's associated with their life. So it's not enough to know who they are, where they live, and what disease they have, but we also need to know how they got it, what obstacles they're facing in getting treated and sometimes what their hopes are for the future, how it's affecting their family, and all sorts of other things about how their health situation is really impacting their family and their community. One of the ways that I'm often interacting with healthcare professionals and researchers in the field is that they're my point of entry into the places I'm going. They get me into the clinics, they get me into the hospitals, and they introduce me to the patients. And that's really important because I'm sort of trading on the trust that they've already built with the patients. I think visual journalism is one of the most powerful tools we have to really engage people on issues and to give people an emotional understanding of what's happening. Whoever you're talking to, you want them to care about your issue, and that can't be done with data alone, that can't be done with writing alone. You need to do something to help them really see the impact of the issues that you're working on. And I think that journalism and the way journalism uses personal stories is a really powerful way to do that. If you use that as a tool, as sort of an entryway for people, then you can go into the more systematic approach and the more data that's really going to back up everything you're talking about. But to start, you need to find a way to really engage people. So when you think about communicating the issues you're working on, it doesn't begin with someone who's sick and it doesn't end with someone who's healthy. It begins with who they are as people and it ends with what they're able to do when they're healthy. So the conversation doesn't end where your research ends, but it ends with what those people are able to do once they get healthy or what they're not able to do because they're sick. Visual journalism can be a really important way to give a face to the issues that you're working on. You know, these aren't things that exist in a laboratory or in a research paper or even just in a newspaper article. They're real things that are happening to real people and they have significant consequences. And pictures are a really easy way, and video is a really easy way to show people that this is reality in a large part of the world and these issues have real world consequences.